So, Lisa, thank you so much, first of all, for talking to us today. I just want people to get kind of an idea of what you have been through over the last several months with us. Can you tell me why you first came to see us?
I came to see you because I was in a lot of pain, and the pain had gotten so bad that I was going to have to quit my job because I have an active job. I'm a preschool teacher.
And where was your pain?
I had pain in my neck, and I'd had that for about 20 years. And then I had pain in my low back, which I've had for about 15 years.
And it just kept getting worse?
Mm-hmm.
Okay. And why didn't you go the traditional route and do like pain management injections and RFAs and maybe even surgery?
I started with chiropractic, physical therapy, massage, and that worked to an extent so that I could function up until about a couple years ago. And
Okay.
then despite using all of those tools available to me, I didn't get any pain relief.
Okay.
I had spoken to a doctor a few years ago about cortisone injections and was told that you can only have a certain number of them in a lifetime, and they only last a short period of time. So it wasn't a cure, it wasn't an answer. And I never considered surgery because most of the people I know who have had surgery have such a limited range of motion afterwards, and it doesn't necessarily get rid of your pain.
Okay.
And because I want an active lifestyle and my job is required activity, I didn't think those would work for me.
Okay. So you came to see us. I think we did some imaging, right? We looked
Yes.
at your cervical spine and your lumbar spine
Yes.
and determined that you'd be a good candidate. And so you came in and you had the procedure. What did you think about the procedure?
It was really easy. I wasn't here very long. It wasn't painful. I was very comfortable while I was here.
We gave you
And
some good medication,
I did
right?
have some sedation, but I was awake.
Right.
I just didn't feel any pain, and I was relaxed, but I was awake.
Okay.
So I felt like it went quick and easy.
Very good. And how long did it take to start getting pain relief?
A couple of months.
Okay.
So for a few weeks, I had a little bit of discomfort where the cells were extracted. It was tender in those areas. And then about 2 months, I started to notice a little less pain.
Okay.
At the 4-month mark, I would say I was about 50% improved. And at the 8-month mark, I would say most days I have no pain at all.
That's amazing.
Mhm.
That's really exciting. And is that both in your neck and your back?
Yes.
Wow. Okay. And why are you here today?
Because I chose to bank some of my cells and I want to address another area. It's not as much pain. It doesn't limit my life as much as the neck and the back did, but it is chronic pain.
Why have pain if you don't have to?
And I was so successful in the other areas.
Yeah.
Why have pain if there's a treatment out there that works for me?
Fantastic.
So in a couple of weeks, I'll try a new area.
Fantastic. Thank you so much for sharing that with us.
You're welcome.